I'm Dr. John Hesla from ORM Reproductive Medicine, and I want to thank you for coming to my talk this afternoon. Hopefully over the next 18 minutes you'll learn some valuable information about the services that we offer at ORM Reproductive Medicine. I certainly would be glad to talk to any of you on a one-on-one basis, either later this afternoon or through a phone or Skype discussion. But I'm the medical director of ORM Reproductive Medicine, and again, I'm very, very glad to be here with you in San Francisco today to educate you about options for fertility through egg donation and surrogacy. Our clinic has helped same-sex male couples and single men for many, many years now. In fact, we're helping couples and single men from over 40 countries. The reason why we help so many international patients is that we have very high pregnancy rates at our clinic, and patients find out this through the internet and through referrals by surrogacy agencies. So we're very, very proud of our contributions to helping people create families no matter what their background is. We also participate in the GPAP program. We offer an unlimited number of stage 1 discounts, and we also offer a stage 2 discount to people who are awarded them. So if you think you may qualify for GPAP, I would encourage you to apply. Just to give you some information about myself, I'm a native Northwesterner, but I graduated from Harvard University in biochemistry. Then I completed my medical training at UCLA and Johns Hopkins University. After I finished my training, I stayed on faculty at both Johns Hopkins and at Emory University. I developed the egg donor program at Johns Hopkins, and I founded the IVF program at Emory. This was in the 1990s. I became the medical director of ORM Reproductive Medicine in 1999. That was the year that we started our fertility clinic and IVF lab. I'm proud to be a member of the Men Having Babies Advisory Circle, and I'm also the medical director of an online internet organization called Parents Via Egg Donation, where women, men, and couples can receive information about how to become parents through egg donation. Our clinic was originally founded in 1989. We're the largest clinic in Oregon and one of the largest clinics on the west coast of the United States. Last year we did more than 2,000 IVF treatments, and one of the important things for you to know is that we were one of the largest clinics in the country in terms of the number of egg donor surrogacy treatments that we did. We completed 324 surrogate embryo transfers last year. Our clinic has consistently high pregnancy rates ever since we opened the lab in 1999, in the top 1 to 3% of all U.S. IVF clinics in every category, including not only egg donation, but treating infertile women who need to go through IVF to get pregnant. One of the important aspects of achieving high pregnancies through IVF is the quality of the embryology laboratory. And the lab quality can vary from one clinic to the next. Our laboratory was designed by the same cleanroom engineers who designed fabrication plants at Intel, because Intel is a major employer in the state of Oregon. So we really tried to identify the people with the greatest expertise in designing our laboratory, and we have hired the most amazing embryologists who are very skilled at working with eggs and embryos. Your baby will spend the first 5 to 6 days of its life in our laboratory. So the environment in the laboratory is critically important to the success of fertility treatments. Our goal as providers and our mission at ORM Reproductive Medicine is for our patients to have the highest chance of getting pregnant with the very first treatment. No one wants to have to go through an extra surrogacy journey to achieve a baby. So we really focus on every step in the IVF process to maximize the chance of success. By the way, this is a picture of our main office, which is located in the Central Business District of Portland. We have a large staff, a staff of about 125. Portland's a great place for egg donation and surrogacy. We have many healthy women who apply to be egg donors, and many of our donors are willing to have contact with future fathers if the future fathers want contact. Our clinic also has very strong collaboration with surrogacy agencies. Fortunately, there are some excellent surrogacy agencies at this meeting, so I hope that you've all taken advantage of the opportunity to talk to the different agencies that are present. Oregon's also a very good state for the legal aspects of surrogacy, so if you do have a surrogate in Oregon, the process will be an easy one for you. Although many of the surrogates we work with are outside of the state of Oregon, including in California, Texas, Colorado, other states. Interestingly, Oregon has the lowest rate of preterm labor of any state in the United States, and I think that this is a sign that women in Oregon are healthy and they get good prenatal care. And for those of you who are coming from California to Portland for your treatment, you only need to come up for a day, although we encourage you to come for a longer period of time to take advantage of the wonderful aspects of visiting Portland. It's a very charming city of about 2 million people that has excellent food and wine and also beer. As I mentioned earlier, our pregnancy rates are very high. We're very proud of our pregnancy rates, and we encourage our patients to view success rates through different websites. One of the websites that makes it easy to compare pregnancy rates among fertility clinics is this website that's listed here, which actually extracts data from the CDC and SART. But you can also look directly at the CDC website if you want to compare the success rates of one fertility clinic to another. Our team of providers includes about 125. So again, we have a large clinic. We have 7 fertility doctors, 7 embryologists, 4 genetic counselors who can evaluate your genetic risk of having a child with a disease based on your personal family background. And our genetic counselors will interview and analyze the genetic risk of any egg donor that you might be considering. So we really focus on genetics to try to give our future fathers their best chance of having a healthy baby. We also have a team of providers who works with our patients to help them through each step in the journey. So you would be assigned a primary treatment coordinator who would be guiding you through the egg donation and surrogacy aspects of your care. So you'd be working with a single physician and a single treatment provider. For some of our patients who are Chinese speaking, we also have 6 Mandarin speaking treatment coordinators. We actually help a lot of men from China because we have an office in Shanghai and we have a concierge service in Shanghai for Chinese patients. But I would say one of the things that we strive for in our interactions with our patients is to make sure that everyone understands that we're really on your side and we're your advocate. So I personally helped many hundreds of patients at this point through this process. So I've seen some of the pitfalls. I've seen things that have gone wrong. Most of the time everything goes right, but we can anticipate problems if they occur and correct the problems to try to minimize your anxiety as you rely on us and rely on your egg donor and your surrogate during your baby journey. So we're always available for consultations via telephone, Skype, and we internet frequently. So we're there for you at every step along the way. We do have our own egg donor program, and most of the men that we help through their fertility journey will select an egg donor through our clinic. Although we're certainly glad to work with any egg donor that you might find through an outside agency, or if you have a family member, a sister, or another relative who wants to be your egg donor, that may be a possibility as well. Over the course of a year, we have about 150 egg donors that we treat directly through our clinic. All of the donors that are available on our donor database have completed all their medical screening and they're ready to go. So if you're interested in any of them and you want to select them, they don't have to go through any additional testing. They've already completed their tests. And we're very picky. Only about 7% of women who initially apply to be donors are actually accepted through the program and go through treatment. Our egg donor treatment coordinators know the donors very well, and we have an egg donor matching coordinator who will help you find your donor and pick the donor with the right characteristics that you're looking for. We don't have any agency charges for our egg donor program, so it does make the overall cost less. And most of our donors are in Oregon, relatively close to our clinic, so there may not be any extra added travel costs as compared to if your donor lives far away. But again, I mean, in the past year, I've treated egg donors who've lived in New York and Texas and other areas, so we're glad to work with a donor that you may find through an outside agency. Our genetic counselors do carefully screen our egg donors to make sure that the donor does not have a family history that might be concerning regarding the possibility that you could have a child with a genetic disease in the future. Our surrogacy program is one that has achieved a high degree of success. And again, that's why one of the reasons why we're helping people from throughout the world. We have very good relationships with surrogacy agencies, and we work very closely with the agencies to make sure that the care that you receive is being very well coordinated. We rigorously medically screen surrogates to make sure that they would have the lowest chance of complications as they're carrying your baby. And we will be treating the surrogate no matter where she lives, whether she lives in Oregon or in another state. We will be treating the surrogate with medications until she's 3 months pregnant, and after that she will not need any special treatment. She'll just receive care through her local obstetrician. Our genetics team really focuses on ways in which we maximize the chance that you will have a healthy child that has normal genetics. And there's different phases of genetic screening. Typically, the first phase is to evaluate the family history of the egg donor to make sure that there are no diseases that have a strong genetic predisposition in her family. So our genetic counselors will interview your egg donor and make sure that the information that we receive is very thorough. The genetic counselor will also talk to you and look at your family history and make sure that the selection that you've made is appropriate to give your future child a low risk of having any medical problems. We'll also do a blood test or a saliva test on you and your egg donor to screen to see if you're a carrier for a genetic disease. An example would be the disease cystic fibrosis, where about 3% of Caucasians are carriers for cystic fibrosis. So we can screen you and your egg donor to make sure you do not carry the same mutation in your blood that could be passed on to a child. We can screen now for about 176 rare genetic diseases. And we do that before you finalize your donor selection to make sure that you've selected the right donor based on your genetic makeup. The other aspect of genetic testing involves testing the embryo. So most of the future fathers that we're helping are electing to have their embryos biopsied so we can analyze the chromosomes of the embryo before we place the embryo in the surrogate's uterus. And that can help ensure that you don't have a baby with Down syndrome or another genetic problem that we can test for ahead of time. And this is just a picture showing how embryos can be biopsied. This is a picture on top of an embryo that is either 5 or 6 days old, and it has more than 100 cells. And you can see the cells are starting to come out of the embryo because the embryo is hatching. And the embryologist can remove about 5 cells from the 100-cell embryo, and the genetics laboratory will then analyze the cells that have been removed to determine if the embryo has the correct number of chromosomes, 46. And this will screen for conditions that might lead to an abnormal fetus. It also can identify embryos that might miscarry or not attach. So we think it's quite effective in terms of trying to maximize the chance of a healthy pregnancy. It's not something that's required. It's an optional part of care, but it's become almost standard now in 2018 because our embryo lab is very skilled at doing biopsies, and we know that taking the cells away to test the chromosomes will not have an adverse effect on the embryo's ability to grow into a baby. So we feel that the benefits of genetic testing of the embryo, which we call CCS, or comprehensive chromosomal screening, includes our ability to identify normal embryos and to decrease the chance of an unsuccessful pregnancy or a miscarriage. What we find when we test embryos from a donor egg cycle is that about 68% of them are genetically normal and 32% are abnormal. These are our pregnancy rates and live birth rates. So if we look at live birth rates, if we're using the CDC data, from a single embryo transfer, the live birth rate is 61%. From transferring 2 embryos, the live birth rate has been 93%. But if we transfer 2 embryos, the twin rate is 70%. This is data from SART, the other reporting mechanism, which again you can look at on the internet. Our live birth rate with transferring either 1 or 2 embryos in a donor egg surrogacy cycle is 73%. About half the patients transfer 1, half transfer 2. The national data, national average for the same year was 60%. So again, we're very proud of our statistics. This is just another table that's a little hard to see, but this, if you look at the very last column, that's the donor egg pregnancy rates and live birth rates. And for our clinic from 2000 to 2014, we analyzed our live birth rate data for donor egg IVF, and it was 75%. The national average for live births in 2013 was 55%. So we've consistently been higher than the national average for many years in our egg donor program. Yeah, this slide. Well, whenever you put in 2 embryos, there's a greater chance that at least one will take. So the 93% is either being pregnant with 1 baby or 2 babies, yeah. Okay. It's 70%. So there's 69 to 70% chance of twins, about a 29% chance of 1, and about a 1% chance of triplets, because an embryo can split into 2. So that's something to be aware of. Okay. So I'm going to have to conclude now, but I'd just like to mention that the part of the important team that makes this possible is our egg donors and the wonderful women who are surrogates for our patients, and I want to salute them.